What if your heart has been misfiring right now while you sleep, while you eat, while you go about your day, and you have absolutely no idea? No pain, no dizziness, nothing. Just a silent electrical chaos happening inside your chest, quietly forming blood clots that could travel to your brain at any moment and cause a massive stroke. This condition is called atrial fibrillation, and most people who have it have never even heard those two words. Today I am going to show you exactly what AFib is, why it is the #1 cause of preventable stroke in America, the 7 warning signs your heart is sending you right now, and the one test that detects it in 30 seconds. Stay until the very end, because sign number 5 happens to millions of people every single night, and every single one of them blames something else. Here is what happens inside your body when you have AFib. Your heart has 4 chambers. The 2 upper chambers, called the atria, are supposed to squeeze in a smooth, coordinated rhythm, pushing blood into the lower chambers and out to your body. In AFib, the electrical signals controlling those upper chambers go completely haywire. Instead of one clean signal, hundreds of chaotic signals fire at once, causing the atria to quiver and shake instead of squeeze properly. When the atria quiver instead of squeeze, blood does not flow out cleanly. It pools, it stagnates, and pooled, stagnant blood does one thing: it clots. When that clot breaks loose, it travels through your bloodstream straight to your brain, blocking an artery and killing brain cells in seconds. That is a stroke. AFib is associated with a 5-fold increase in the risk of stroke, 5 times. And AFib-related strokes tend to be more severe and more likely to lead to death or permanent disability than strokes from other causes, causing blindness, paralysis, inability to speak, and complete loss of independence. Now here are the 7 warning signs that your heart may already be in AFib right now. Warning sign number 1: a fluttering or flapping sensation in your chest. People describe this in different ways: a flip-flopping feeling, a fish flopping in your chest, a rapid vibration behind your sternum. It may last seconds or minutes. It may come and go randomly. Many people feel it most when lying down at night and dismiss it as anxiety or too much coffee. This sensation is your heart's upper chambers quivering instead of beating. It is the most classic symptom of AFib and one of the most ignored. Warning sign number 2: a racing heartbeat that comes out of nowhere. You are sitting still, you are relaxed, and suddenly your heart is pounding at 130, 150, even 180 beats per minute for no reason, and then slows down just as mysteriously. This is called a paroxysmal AFib episode, where the heart suddenly switches into a chaotic rhythm and then back again. Most people who experience this write it off as stress or caffeine. Their doctor never hears about it, and their stroke risk silently climbs. Warning sign number 3: sudden unexplained dizziness or lightheadedness. When your heart is in an irregular rhythm, it pumps blood inefficiently, and your brain gets less blood flow than it needs. This causes sudden dizziness, a feeling that the room is tilting, sometimes accompanied by a sense of almost fainting. These episodes are brief, they pass, and most people never connect them to their heart. Warning sign number 4: shortness of breath during activities that never bothered you before. Climbing one flight of stairs leaves you breathless. Carrying light groceries makes you winded. This happens because a heart in AFib cannot pump blood efficiently enough to keep up with the oxygen demands of even mild exercise. The heart is working harder but delivering less. Your lungs feel the strain first. Warning sign number 5: waking up suddenly in the middle of the night feeling your heart pounding or racing. This is the one that affects millions of people every single night, and every single one of them blames stress, a bad dream, or eating too late. AFib episodes frequently occur during sleep when the nervous system shifts, triggering the irregular rhythm in vulnerable hearts. If you regularly wake at 2 or 3 a.m. with a pounding or racing heart, your heart's electrical system needs to be evaluated. Not tomorrow, now. Warning sign number 6: extreme fatigue that appears suddenly and for no reason. Not the gradual tiredness of a long day. A sudden, heavy exhaustion that drops on you out of nowhere, sometimes in the middle of normal activity, forcing you to sit or lie down. This happens because a heart in AFib is using enormous energy trying to maintain circulation through an inefficient, chaotic rhythm, depleting your botus energy reserves rapidly. Warning sign number 7: a feeling of chest pressure or discomfort during an irregular heartbeat episode. Not a sharp pain, a dull pressure, a heaviness that appears and disappears with the palpitation episodes. Many AFib patients misidentify this as a heart attack symptom and panic, while others dismiss it entirely. The reality is that this pressure is your heart muscle straining under the workload of maintaining circulation through a chaotic rhythm. Now, here is the most important thing I will tell you in this video. There is a test that can detect AFib in 30 seconds, and you can do part of it yourself right now. Place 2 fingers on the inside of your wrist just below the base of your thumb. Feel your pulse for 30 seconds. A normal pulse is steady and rhythmic, like a metronome. An AFib pulse feels completely irregular, skipping, jumping, varying in strength from beat to beat, like a completely random drum pattern. If your pulse feels irregular right now, go to an emergency room today. For a definitive diagnosis, ask your doctor for an EKG, a simple, painless test that takes less than 5 minutes and shows your heart's electrical activity in real time. If your doctor suspects intermittent AFib, they may give you a Holter monitor, a small device you wear for 24 to 48 hours that records every heartbeat, catching episodes that a standard EKG might miss. The good news: AFib is treatable. With the right medication, lifestyle changes, and in some cases a procedure called cardioversion or ablation, AFib can be controlled and stroke risk can be dramatically reduced. But only if it is caught. Only if you act. If this video helped you, share it right now with someone over 50 in your life. Because AFib becomes dramatically more common with age, and most people carrying it right now have no idea. Subscribe and hit the bell, because in my next video I am going to reveal the 5 early warning signs of a stroke that appear hours, sometimes days, before it strikes, and the one action in the first 60 minutes that determines whether a stroke victim survives or is permanently disabled.